these days, we're getting a lot of questions regarding rhinoplasty. So I'm doing an introductory video to establish the basis of understanding of more complex situation. So as you see in these photos, there are three parts to the nose. We have the top part, which is closest to the skull, which is mainly bone. We have the middle part of the nose, which is mainly cartilage. And then we have the lower part, which we talk about it as it is a tip, but it's obviously more than just a tip. In the top part, which is the bony part, essentially it is to correct a hump. All humps are not only made out of bone. A large portion of the hump is made out of cartilage. However, it will have frequently a bony component, and therefore this will have to be either rasped or shaved down. If there is a space between the right nasal bone, the left nasal bone, and the central component, then this is when we will create what is called an osteotomy, which is to break the nose in order to close that gap. The other reason where we would do what is called an osteotomy is if we want to narrow this part of the nose and bring it in. So we will crack the bone to allow narrowing of this part of the nose. Now when we come to the middle section of the nose, we have, as you saw, cartilage. Now let's go over the images one more time. In the first image, the skin has been removed and we see the side component of the cartilage in the middle segment, and it's more or less triangular in shape. It is called the upper lateral cartilage. In the second sketch, you can see what's called the septum, which is a separation between the right side and the left side. And when there is deviation in that septum, we call it a deviated septum, because when it is significant enough, we would want to correct it to improve the breathing. Now also, it is important to realize that it's the cartilage in the septum that is sometimes harvested and that we will use to reconstruct other parts of the nose. Unfortunately, if somebody has had a previous nose surgery, that cartilage has been removed and is not available. It is also in this middle segment that we have to correct the hump. This is where we have some differences between the right side and the left side of the nose that we will try to correct. And this is where we're going some time to put some pieces of cartilage called graft in order to improve the breathing and the air flow within the nose. The last part is what we call the tip. That requires a very exhaustive discussion that we will leave for another time, and this is the lower segment. As you can see from the sketches, the cartilage has a complex structure. There are two of them, one on the right, one on the left, and it starts in the midline and curves to the side. But let's be aware of certain aesthetic principles, namely that working in the nose is mainly to create balance. And so the nose has to be in balance with itself, and in general the tip has to be either at the level of the dorsum or preferably a little higher. Now in main nose we try not to make it much higher for fear of making it effeminate. But for women, it's usually quite attractive to have the tip a touch higher than the dorsum. Another consideration when we talk about balance, particularly in the profile view, is the balance between the nose and the chin. Many times, if the chin is pushed back or called retrusive, then it will automatically create a more projecting nose, and although the nose would be adequate in size, it will look too big for the face. Another important consideration when we approach the issue of balance is to have the nose balanced proportionate to itself, but also have the face in complete balance. And many times, when the chin is retrusive or pushed back, then on profile view, the nose will appear overly long and projecting. And although by all measurement it will be acceptable in size, it will appear to be much larger. When it comes to the tip of the nose, it is very complex in discussion and deserves its own little segment. But just will mention that we will work on the tip here, the distance between the two cartilages, the width of the tip, the relationship of the tip height to the dorsal, the width of the base of the nose, and so on and so forth. So there are a lot of consideration, and they deserve their own video.